Arkansas says it does not have enough contact tracers to stop the spread of the coronavirus. KNWA's Clarissa Bustamante shows us the value of these jobs and the difference between what the Department of Health has now and what it actually needs.
We would like to have more, and we are increasing our capacity for that. We need more.
Right now, the Arkansas Department of Health has just under 200 contact tracers. These are people who interview COVID-19 patients and trace their footsteps.
We ask about where they have been, who they've been around, who lives in their household.
The ADH then follows up with those who may have been exposed and asks them to quarantine immediately,
so that if they were to develop COVID-19, they would not spread it to other people.
Dr. Jennifer Dillahay with the ADH says with the governor opening the state back up and residents beginning to leave their homes, it's vital to employ more of these workers.
We will need almost 900 people or maybe even more.
To do this, the ADH is looking at various options.
One avenue may be to hire more staff. Another avenue would be to partner with organizations that can hire staff, or to contract with a organization.
At a press conference Wednesday, Secretary of Health Dr. Nate Smith broke down the various professionals currently working as contact tracers. This includes disease specialists, epidemiologists, and college students and staff. He says in the next few weeks, the department expects to train and employ over 200 more tracers.
We're waiting to equip them with laptops and cell phones so they can pick up the work.
In Fayetteville, Clarissa Bustamante, KNWA Northwest Arkansas News.